Welcome everyone to our level 1 ChimeraFit class. Today we're going to do a full body workout, a little bit of extra attention to lumbo-pelvic stability, so that's just our low back and pelvis. So we'll work on, we'll use our Pilates ball a little extra for an unstable surface, and then we'll also use bands and weights just like usual. And in fact, we'll start with your ball laying on your back. So we're going to do a little bit more of a focus on dynamic stability. So can we control the movement in your back and your pelvis rather than just holding it perfectly still all the time? And what we're gonna do is take your ball, if you don't knock it away, and bring it under your tailbone. Anchor your head on the ground, and then just for a moment, we'll do a little bit of a pelvic tilt. So you can adjust the ball a little bit so that it feels like you've got a little room to tip your pelvis forward and backwards with the heels anchored onto the floor, but just a little bit of movement, tipping your tailbone forward, a little bit of a rock going back, and controlling that movement as best as you can. So you're not just jumping from one position to the next, but allowing yourself to just take a little time as you roll from one tilt, anterior tilt when your tailbone goes down, posterior tilt when the tailbone comes up. Inhale during the forward tilt, exhale to tip back. And if there's any parts of that range that feel uncomfortable, just keep it a little smaller. And then we'll come back to a central position and then try a little bit of a tilt side, like a lean rather, side to side, like you're going to push the ball over to the left and then push it a little bit over to the right. So not too much movement happening in your rib cage, but allow your pelvis and your low back to control that side to side movement. You might get like a little bit of a stretch on one side of the low back versus the other, or on both really. And then we'll come back to the center. Find a spot that's pretty much neutral, and then we'll bring your knees up to a tabletop position. And then try again with your knees up, a little bit of a tilt forward and back. If this is any strain on your back, feel free to keep the feet down on the floor like we were. Just a little rock back and forth, and then try a little shift of the hips or the pelvis side to side. So you're rolling the ball a little bit to the right and a little bit to the left. Very fine-tuned, small control of the pelvis, one more each way. And then when we come back to the center, we're going to pause there for a moment, maybe float your arms up, see if you can balance without the hands, option to leave them down if you need to. And then we're going to reach the left leg out away from midline as far as you can without changing the position of your pelvis. Now we're going to hold it still. Come back to the center. Now that we did all that moving around, now we'll reach the right leg. And slowly bring it back. And then reach the left. Option to add an opposite arm reach for a little more challenge. More of a dead bug, classic dead bug movement. And then back to center. Then right leg, left arm. Reach, want to hold, hold, hold. And slowly bring it back, knees, toes together. Switch and reach. Hold, hold, hold. We'll bring it back to the center. And then left arm, right leg. Reach and hold, 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 and back to the middle one more time. Find that connection between the ribs and the pelvis. See if when you extend the leg, maybe go a little farther, but without letting your back move with you, reach a little longer and then come back to the center. Nice. You can let your feet down. You can lift the hips up. Get rid of the ball, let yourself roll down one vertebrae at a time, and then we'll pass the ball off to your knees or your ankles for the 100. So find a position. If your legs need a little bit of a break, rest them on the floor for a moment, and then when you're ready, we'll re-find our tabletop position. Take a breath, and then on your exhale, add a small crunch and pulse the arms down for 1, 2, 3, 4, 5, and exhale, 2, 3, 4, 5, and 2, 2, 3, 4, 5, exhale, 2, 3, 4, 5. Here's 3, 2, 3, 4, 5. Exhale, 2, 3, 4, 5, and 4, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. This is 5, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Then heels together, toes out, externally rotate. And exhale, 2, 3, 4, 5, and 7, 2, 4, 5. Exhale, 2, 3, 4, 5, and 8, 2, 3, 4. Maybe reach the legs a little longer. 9, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Last one, 2, 3, 4, 5. You got it. Exhale, 2, 3, 4. Hold, and then you can rest down. You can leave the ball off to the side for a moment. Hug the knees to your chest. Give the low back just a little bit of a sway side to side. And then if you've got a loop band, go ahead, grab it. I'm going to bring it just around the legs, just over the knees. Anchor the heels to the ground. We'll get ready for a little bit of a bridging movement. So we're going to check in with our stability here. Tucking the tailbone, peeling yourself up one vertebrae at a time. Chin lifted, heels anchored strongly into the floor. Reach your tailbone out toward the shins. And then slowly roll back down. That nice controlled segmental movement, one vertebrae at a time. Take a breath. Exhale, press out against the band. Scoop the tailbone just a bit. See if you can move as controlled as possible. Once we come up to your bridge, now we're going to pause here. Option to float the arms up, and then we're going to try a little hip dip. So letting your left hip drop down toward the floor, come back up, and then your right hip drops down. So we're tilting your pelvis a little bit side to side. Tip the left hip down, press through the heel to lift it back up, and then the right side of the pelvis drops down and bring it back up. Left side drops down and slowly come back to neutral. Right hip down and up, chin lifted, left and back to center, and then right and back to center. One more time on each side, so making a little bit of control over your pelvis in a moving position through your bridge. Good. We're going to roll all the way down. Once we come down, you can remove the band, hug the knees to the chest, and give yourself a couple of rocks to come up to sit. And if you're comfortable to go all the way up to stand, we'll do about 2 more. And then roll all the way up to standing, or just bring yourself into standing, however you feel like you'd like to do that today. Inhale, reaching up with a little bit of a back bend. Exhale, forward fold. Inhale, lifting up to a flat back. Exhale, forward fold. And then we'll step back to a plank option to go down to forearms, wrists, knees, any plank version that you need to do today. We'll lower the chest. Knees down first if you need to, chaturanga. Inhale, just a gentle back bend. Exhale, back up to hands and knees, toes turn under, hips up to a down dog. Reach the tailbone up toward the sky, and then we're going to reach your left hand toward the right knee, shin, or ankle, adding a little bit of rotation in the upper back. Set that hand down and switch. Right hand to the opposite side, tap. And then back to the center. Left hand to the right. Back to the center. And right hand to the left. And back to the center. Nice. We're going to step forward to your forward bend. Wiggle the toes, round yourself up to stand. Inhale, reaching to the sky. And exhale, hands come to prayer. And then we're going to stand with your feet about hip width apart. So similar to some of the pelvic movements we were just doing in laying down. And check in with that a little bit in standing. See with your feet about hip width apart. We're going to do a little bit of a circle of your pelvis. So starting with soft knee bend, we're going to rotate the pelvis underneath your rib cage in a circle, kind of like a hula hoop type motion. So we're going to the right, back, left, and around. It's like if you could draw a circle with the tip of your tailbone. There's a laser pointer on the very end of your tailbone. We're drawing a small circle back behind you. You're going to let your knees bend a little bit so it's free to move. And then circle the other way. And if it's a little awkward and funky, like, don't worry about it. It's maybe an unfamiliar movement if you're not used to hula hooping or doing like complicated dancing type movements, but really good to work on control of our pelvis in a few different directions. And then we're going to settle that back in the center, so not side to side, not forward and back, like right into that neutral spine position. Memorize where that's at. Bring your feet together, and then we're going to shift the weight to the right foot, so keeping that neutral pelvis position, lifting up the left knee, head and shoulders lifted. Find your balance, and just keeping a 90-degree bend at the hip and the knee. Chest lifted, hold here, and we're going to float the arms up, straight ahead. So reaching forward, shoulder blades back. And then let the hands back down, but keeping the knee up, floating the arms up, so a little bit of a challenge for your balance, and then back down. And 2 more. We're going to reach the hands up, reach the crown of your head up to the sky, and then back down. And we're just going to 90 degrees, just reaching the arms forward, not all the way to the sky, so it's even more work for your balance, having your arms forward, back down, and then switch sides. So we've got our neutral pelvis position. Shift the weight to the left knee, bring the right knee up to our 90 degrees. Pause and hold here, and then we're going to reach the arms forward. Notice your back muscles starting to do a little bit more work as the hands are reaching forward. Slowly bring them back down. Reach the arms up. Imagine your spine getting longer as you reach the arms up, and back down by your side. 2 more. Reach up and maybe flex your toes up to the sky. Get the front of your shin muscles, working. And back down. If you ever stumble over your toes when you're walking, it's because these muscles aren't doing enough. Up we go, and we reach, 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 reach. Set everything back down. Give your arms, legs a little wiggle. And then we're going to grab your loop band again. And option to grab a little weight for some squats. So take whichever version of squat is working for you today. We're going to combo squat with an overhead press. So we're going to have the band around the legs. Hands are going to come to shoulders. So we're squat down, press out against the band a bit, sit back into our chair, then we'll come up and reach up overhead. 1, down, and up. That's 2. Squat, and 3. Down, and 4. Squat, high Dio. 5, good. Knees over that second, third toe. 6, we'll see if he stays a good boy. 7, down, neutral spine. 8, 2 more. 9, option to do a few less if you are not feeling all the way up to 10 today. Perfect. Gonna let that down, set the weights down. We'll keep the band around your legs, and then we're gonna do a 1 leg balance. So option to hold on to something here. And then we're going to shift the weight to the left leg, bend the right knee, pelvis relatively level, and then a little bit of a standing clamshell. So you can imagine like your foot is anchored into a stirrup, reach that right knee out, and a little bit of a twist, and then back in. Pelvis stays right where it's at, looking good. Little rotation out, and back in. Little lift, and down. Can maybe hinge forward slightly, reach, and down. Up. We're adding a little pause there if you notice at the top, so we're not rushing. 2 more slow. Back in. 1 more time. Reach. Back to the center, and then we'll set that side down. Shift the weight. Check that we've got nice steady position of the pelvis, and a small baby twist. Left knee comes out, and back in. Out. And in. 2. Press. Good. If you need to do a little movement of the arms, quite all right. And back in. 3 more. Reach. And back. Reach it up. And back down. 1 more time. Up. And down. Nice. We'll let the foot down. And then just hinging forward, so weight even on both feet. I'm going to hinge down, reach toward mid-shin, and press back up, giving the hamstrings a little bit of a stretch. Neutral spine, hips way back behind you. And up we go 2 more times. When you come forward on the next one, option to reach arms overhead. So we're hinging forward, adding a little bit of load by having the arms up. Press through the heels to return to stand, and the one extra. I know I said one more, but one more with the arms up. And then up we go. Nice. We're going to rest the arms down and get ready for another round of our squat. So grab your weights and Dio is going to go over here. All right. I thought he would be good, even though he never is. I don't know. You got to give him a try sometimes. All right. So we got our squat. Same thing. Hands to shoulders. Use your band for a little support, and then we'll sit back and press up. 1. Weight even on both feet. 2. Nice. Hips and knees bend together. 3. Maybe challenge yourself to let your hips come smidge lower. 4. Or reverse if there's any knee pain, keep it smaller. 5. Option to have a chair there behind you. And press. 6. And exhale through the hard part at the top. 7. Down. And up. 8. Press it up. 9. And reach is 10. Good. We'll let the weights back down. You can get rid of the band. Take a breath. And then we're going to take long band. Step on it with both feet. Feet about hip width apart. So in going into our hip hinge that we just warmed up a moment ago, finding your hip hinge, pause here for a moment, and then one arm row. So you're going to lift one arm and pause for a second. Notice how that throws you off balance a little bit. Your back muscles have to do a little bit more work. Slowly let that side down, and then row with the other side. Pause for a moment. Bring it back down. And then we're going to lift the other side. See if we can lift the arm without twisting the back. And then the right. And down. Lift. Can keep the movement small. It doesn't have to be big. Right, but we do want the shoulder blade moving toward your spine. Think about starting with your shoulder blade left. Comes up, pause with a little hold at the top and back down. And then the right. And one more left. And one more to the right. Bring it back, press through the heels to come back up. Holding onto the band, give your shoulders a little bit of a roll. And then we can step off the band, wiggle the fingers, give them a little bit of a rest before we do one more movement here with the band. We're going to do just a straight pull apart with that hip hinge, or option to do it completely standing if the hip hinge is not feeling good today, but with palms down. Just going to hinge back, neutral spine, and then bringing the band apart and back in. Giving that a little pull and slow. Head nice and centered on your body and back. Nice. Pull. If there's any shoulder range issues, just start with just a small pull. Doesn't have to be the full range of motion. And 3 more. Good. 2, weight even on both feet. All 10 toes anchored to the ground. Pull, and then up we go. Nice. So you can push or throw the band off to the side. Find the back half of the mat. Take a nice big inhale to reach up. Exhale, forward fold. We're going to walk the hands forward to a plank. Option on, well actually, in fact, all of us are going to drop down to the elbows then. Option to come down to the knees once we're in our forearm plank. And then, once you're here, take a breath, and then we're going to try to step up. Left leg is going to straighten, and then the right. And then try a tiny twist of the hips to the right and to the left. A little baby twist left and right. Option to do this kneeling, of course, if the version on the toes is a little much. And right and left. Right, not in too much of a hurry. 2 more. twist, twist, and little turn, and little turn. Beautiful. We'll come down, let your pelvis down. You can just rest in a little Sphinx pose. Tops of the feet press into the floor. Push the hands down into the mat. Nice long neck. Nice. We're gonna let everything come down. Bring your hands into the shoulders just to lift yourself back up to a hands and knees position. And then we're gonna walk your hands forward just a bit. Let your chest drop forward into a puppy pose. So just gonna lean forward, chest opens up, and then come back up. So just pausing there for a moment, more of a dynamic version of it. So hips stay lifted, chest reaches forward, take a breath. And then exhale, come back to a more neutral position, 2 more, reaching your chest down. And then 1 vertebrae at a time, coming out of it. 1 more time, we'll reach your chest toward the floor, give the shoulders a little stretch, and then come back up. You can bring your knees forward, swivel them around, extend the legs here along the mat. We're gonna flex your toes toward the sky. Reach your arms forward, shoulders anchored onto your rib cage, sitting up tall. We're gonna round your spine. Make sure you got plenty of room behind you for rolling down. There we go. Ribs anchored on the floor as you reach up. Inhale. Exhale, tuck the chin. Option to use a knee if you need a little help to get up. Inhale, reach. And exhale, slow. Then controlled. Bring it down. Exhale. Through the hard part. Inhale as we reach. Calves anchored to the floor. Notice if you tend to shift your pelvis a little bit now that we've done all this little bit of work on the control over your rotation and bending in your pelvis. Notice if as you sit up, if you tend to shift to one side or the other and make a little correction to keep that even. So you have an even stretch through both sides of the pelvis. Lay down right down the middle of the spine, and 2 more. Exhale. Inhale, reach, keeping your spine nice and tall. Even when we're bending. Roll right down the middle, and 1 more time. Once we come up, we're going to reach right hand toward left pinky toe. We're going right into a saw. 1, 2, 3 stretches, both sit bones glued to the ground, sitting up, and then reaching to the right for 1, 2, 3 exhales. Inhale, up we go. And to the left for 1, 2, 3. And inhale, up we stretch. And to the right for 1, 2, 3. And up to the left. Let's flex the toes up. Maybe give the calves, sciatic nerve a little more stretch. And to the right. 1, 2, 3. Nice long reach. And up 1 more time. 2, 3 exhales. Inhale, sit up tall. And then to the right. 2, 3. Inhale, up we go. We're going to bring your arms forward, tuck the chin, roll down a slow motion as you can. And then once we're on the floor, adjust if you need to. If you're not all the way on the mat, we're going to bring your knees back up to a tabletop position. So head anchored to the ground. And then if you want, what we'll do is we'll cheat. This is kind of a cheat. You can bring your hands under your tailbone. If this bothers your shoulder, don't worry about it. But seeing if with some support for your pelvis, we're going to do a double leg lower, letting both heels come down to the ground and back up. We'll lift the toes up, slowly lower down. And back up, just using that little bit of help from your hands. Down. And up, and then press the feet out, away. So long reach. Hold there. Bring it back in. Reach out. Hold, hold, hold. Bring it back in. And then 1 more time, reach out, hold, and then we're going to crisscross the legs. 1, 2, 3, 4, 5. Keep breathing. 6, 7, 8, 9, 10. Bring the feet together. Hug the knees into the chest. You can unwrap your hands from their pelvis. And then 1 more time, try it without the help from your hands. Same start position, knees in our tabletop. Press the legs out. You may not be able to go as low, which is fine. Just go to the distance you can without changing your back position. Then 1 more time, a little crisscross. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Nice. We'll hug the knees. Rock yourself up to sit. And then we're going to come up to a hands and knees position just for a moment. Option to come up to fist or down to elbows. And in our hands and knees position, we're going to try a little bit of a pelvic tilt side to side. So just letting your left side of the pelvis lean to the left, right side leans to the right, creating like a little bit of a side bend in your body, both directions. And then come back to the center, keeping the pelvis neutral here. Shift the weight to the right knee, and then just like that clamshell we did in standing, now doing it here on hands and knees. So the knee is going to come out to the side. Pause and hold there, and then add a circle with the knee, keeping the pelvis really still. And then reverse your circle, going backwards, around, and down. Good. And then coming back to the center, switch sides, lift the right knee, head in line with the rest of your body, and then we'll circle that right hip. You can imagine like there's a little marble sitting on your tailbone. We're trying not to let it move. And then reverse your circle. Nice. When we come back, we'll bring toes together, knees apart, just resting in child's pose. And then we'll press up, swing the legs around, and then lower yourself back to the mat to lay on your back for Shavasana. Feel free to grab a pillow, anything you need to be comfortable here. Palms to the sky. And close the eyes and reconnect with your breath. Once we did all that work and controlled mobility of the pelvis and the lower back, especially notice if there's any tension in the muscles around the pelvis, around the lower back. See if as you breathe, we can let any of that tension go. You soften the eyes, the forehead, the jaw. You can even count the breaths as they go by if your mind is feeling extra busy today. Inhale 1, exhale 2. Continue on until you get to 10. And repeat. And then we'll bring a little movement back to the toes, the fingers, and turn to your side. Pause here for a moment. And then when you're ready, go ahead and come Come on back to sit. We'll finish by waking up with an inhale, reaching up, exhale, bringing your hands back to prayer. Close your eyes, giving yourself a little bit of gratitude for taking this time for yourself today on the mat and for all those movements that you were able to do. Namaste. All right, hope you enjoyed that class. If you're looking for more help with stability, specifically if you're looking to help with hip tightness that sometimes we get because our hips are not feeling as stable as they should, or if they feel like your hip flexors are tight, I've got a video on that, so be sure to check that out on my channel. Let me know what you think, and thanks for watching.